Welcome to my YouTube channel, and I am Dr. Kandari, and I hope you all are well, doing good. So today, it's a very special episode I have brought to you. My close friend, Dr. Sayali Kandari, and she is really very genuine reproductive scientist and a specialist in embryology and genetics. At the same time, she is also an entrepreneur, and this is very rarest of the rares. I have seen that a scientist, a woman scientist, and became a now entrepreneur. And she has really done real different work in her field, and I thought to take her to you, and we can have a more deep discussion with her about her education, about her work, and definitely this discussion will help you out in your day-to-day life. At the same time, the scientists, women scientists, and the women entrepreneur who are looking for this the profession. And thank you, Dr. Sayali, for accepting my invitation. And I was really waiting for you to come for my this YouTube channel, and I'm really happy to introduce you to my people. Yeah.
Thank you so much for inviting me to this YouTube channel, and I know Dr. Himangi since some time. She's one of the most gregarious people I've met, and I'm sure she's reaching the audience in a very authentic way. Thank you so much for inviting me. It's an honor and a pleasure to be here, and I'm very excited about talking about my field. I'm very passionate about it. So you can, bang the questions to me whenever you can.
Yeah, and I really know that these discussion will be helpful because our discussion will go with the topic of sexual wellness, and at the same time reproductive health. This is really very important and dominant area at present. So can you just give a brief introduction about your education and your work?
Yes, I basically it's a bit of a long introduction because I just wanted to understand from where I come from. I've done my bachelor's in biotechnology. I used to work in a lot of different disease profiles. I've always been interested in the clinical and the healthcare scenario, primarily because I belong to a family that comes from. We have a lot of doctors. My parents are doctors themselves, and but being a technical person myself, I was very interested in how technology, biotechnology, and healthcare came together. So. I took the decision. I went to do my biotechnology with Pune University. I did my master's in biotechnology in US in Northwestern University. I had the huge honor to work with Dr. Teresa Woodruff's lab. Before that, I worked at Dr. Seth Corey's lab. I started by working on cancer research. I moved to doing reproductive cancer research after a certain point of time. And one of the most enriching experiences of my life was working with patients, working with the big Lurie Cancer Center there. So when you have a direct interaction with the patients, when you know what really is required for them to get well, I think it really changes your perspective as a scientist and as a researcher. And we had the huge honor to do that. So that's the lab that actually came up with the artificial ovary in 2021. And so I'm a huge fan of their work, and it was a pleasure to contribute. After that, I also did my super specialist training in embryology. I did it via Cleveland Clinic, and it's one of the most premier institutes that teaches you clinical embryology. That's basically the science of how to form embryos, how to maintain the state-of-art laboratories, to actually fertilize embryos and bring them to the stage of where it can form a fetus inside the woman after you transplant them. So again, it was a very niche field. It developed my interest in reproductive medicine, and I never looked back. After that, I moved to India. and I could work for my own people, and it's been 15 years. It's been 15 years.
Yeah.
So and I did my PhD in regenerative medicine after that, and as well as PG certification in genetics, reproductive genetics with MUHS. So I've had, like I said, a huge honor, and I'm very grateful to all my teachers because of whom I was able to come to this particular path and really choose to do reproductive medicine.
Yeah. So it's a huge experience, and you have really done a great work in this field. When you were giving your introduction, you said one word, that is artificial ovary. What is that?
So so I know it would be very interesting to know what an artificial ovary is. So really, that's what I said. That's where technology and science and healthcare comes together. We used to work on biomaterials to actually develop follicles that came out from the mice so that they develop oocytes or eggs outside the body, ex vivo, instead of inside the mouse itself. Now, what happens is, this is useful when you have a cancer patient. So, how does it really matter to a human being? So, when you have a patient who has cancer but is not yet menstruating, imagine a 10-year-old girl gets cancer. And she's not menstruating. She cannot form any eggs. Imagine her future. Because now, today, when you get cancer, your chance of survival is more than 80%. And it can go up to even 95% with the current drugs and all the modalities. So when most of these women are going to survive and have no ability to have children after a certain point of time, because all the chemotherapy, all the radiotherapy that is required for cancer, unfortunately, our eggs are also stem cells. So they are destroyed alongside with cancer cells. So what really options are there for that woman, for that girl? And even for the boys, pre-pubertal boys who have not yet, reached puberty. So, artificial ovary was, so that's a branch of science that was developed so that tomorrow there would be an ability to take out ovarian tissue and to grow it outside the body and form eggs when they really are ready to have children. And to be very honest with you, I can tell you the science is growing day by day. Day by day. We have done some ovarian tissue freezings. And so yes, there are a lot more options for women and men with cancer today than there were 10 years ago or 15 years ago when I started. Even more than 32 years ago when my mother started. So, every day the science is moving, and it's a very exciting time.
That is really a very amazing thing, and it is really helpful to almost all generation of women, because nowadays when we see women are getting married in a late age, at the same time they really think of having a kid almost maybe about 40 or maybe 45, and then at that time their reproductive health maybe not helpful, or maybe not giving that supportive kind of thing to them, so that such kind of artificial ovaries may helpful to them. So
I hope so. But one of the modalities that is currently available, because artificial ovaries, it may take years to really come in practice. Because here we are talking about research. Some research makes it to the bedside, some research makes it to the hospitals, some of it doesn't, and some of it stays very expensive. So at this point of time, when you're talking about women of advanced age, whenever a woman goes above 35, her ability of creating eggs and having eggs. So we have a limited pool of eggs. Women have a limited pool of eggs throughout their lifetime. We have at max 6,000 eggs for our entire lifetime. And we menstruate every month, and every month we are releasing 1 to 2 eggs. We get periods every month. Now the thing is, when your age increases, the eggs that are being released are not as normal as they are when you're young. So you make the most fertile and chromosomally, genetically normal eggs between the age of 21 to 29.
Okay.
And that's a very, very short frame of time, and that's the time when most women are studying.
Yes.
They're making their careers.
Obviously.
I myself was making my
Very
career
true.
at that point of time. And it's a sad state of affairs that we really cannot change the biological clock.
True.
So we have to be prepared. I think women need to educate themselves,
Mhm.
need to, we need to know what our options are. And we really have this very good option called social egg freezing.
Yeah. True. Yeah.
So what is social egg freezing?
Okay.
Is basically you freeze your own eggs when you're young.
Yeah.
So that you become your own donor when you're older.
Yeah.
So your own eggs, you would still have the same genetic makeup.
Yeah.
But you would still be a donor for yourself because you're young.
Yeah.
And when you're 40, you clearly do not get the same quality or quantity of eggs.
True.
So,
yeah. So now the surrogacy is also one of the thing, and that is there, and then your egg, you said, donation of your egg, and then you can have your own baby in a later age. So that is also one of the things. Yeah. So in this process, I just want to know what exactly the meaning of sexual wellness.
So, when we talk about reproductive health, we get a lot of patients who actually have sexual wellness issues, which translate into reproductive health issues. So, let me explain. Your sexual wellness is correlated to your psychological health, your hormonal health, your diet and lifestyle factors, and your genetic makeup.
Okay.
Right? So, genetics is something we really cannot do anything about at this point of time, but diet and lifestyle is something that you can work on. There are certain factors like exercising, the amount and duration of exercising that matter. Your diet matters a lot. Your stress level matters a lot because everything comes from your hypothalamo-pituitary axis. So your brain or the hypothalamus is completely responsible for your libido. A lot of times, having asexuality, having low libido can be seen if you have chronic stress. And in modern world, almost every man and woman has chronic stress or acute stress of some sort. And because of this, libidos are going down, sexual wellness is reducing. So there has to be a societal change, or at least an individual change, where these things have to be focused. Thinking about your sexual health is not selfish. It's a part of your health.
True.
If you do not think about it today, it's going to lead to reproductive problems tomorrow.
Okay.
So we get a lot of cases where the patient has premature ejaculation, the male has premature ejaculation or erectile dysfunction, and that leads to a higher chance of cancer in some cases. That could also tell you that he has cardiac issues. There are a lot of times when erectile dysfunction is correlated to cardiac issues in the man. So you do not look at sexual factors and say, these are not important. They are important. They are part of your body. They are connected to your body. And many times it also leads to a lot of infertility issues, which we deal with day in and day out.
Okay.
So sexual wellness is paramount importance as a marker of good health.
Yeah.
As we were talking about, reproductive health is directly correlated to sexual health.
Correct.
So no marker should be ignored. If a woman feels that her libido is reduced over time, she should really seek help for that. Go to a gynecologist and seek help for that purpose. If a man thinks that he's having some issues, either libido-wise or any change during masturbation or any other sort of issue that is directly correlated to sexual health, then definitely it is of paramount importance to get it checked out.
Yeah. So till now, what we more emphasize on women health is a reproductive health, but we never emphasize on man's health is also reproductive health. So that is one kind of really we need to give that kind of publicity or that kind of atmosphere in the society, that reproductive health is not only concerned with women, but reproductive health is also concerned with men, and equally important for both the men and women.
I am
Yeah.
so glad you brought that up. You know why? Because unfortunately, our society is such that they think that the onus of reproduction
Yeah.
is on the woman,
Yeah.
and they think that everything comes
Yeah.
from the woman. Whereas the man is contributing 50% of the genetic
Yeah,
material,
yeah.
and so it's a big surprise, but really not a surprise, you know.
Yeah.
Unfortunately, because of the way society is structured, it's mostly been women who have been treated for reproductive issues, primarily because of the reason that, you know, if you want a child, woman is doing 90% of the lifting.
So
by
biological
creating-
responsibility is she is
Yeah,
handling everything.
she's handling
Yeah.
it because
Yeah.
she's actually,
Yeah,
you know,
producing the kid.
yeah, she's raising the child inside her own womb.
Yeah.
But what I think, fortunately now things are changing a bit.
Okay.
When we see patients coming in, they do have bit of knowledge,
Okay.
much better than when we had started. And what now we are bringing in, and what we have really understood and doing is that when both the couple comes in, you know, when the couple comes in, we tell them we are going to treat both of you.
Oh, great.
We are not just going to treat the woman,
Correct.
we're going to treat the man too.
True.
And we actually have a uroandrologist on the panel
Uh-huh.
to physically check, you know, physically examine the man and get the certain scrotal Dopplers and sonographies done and proper evaluation done. And we have a fertility specialist or a gynecologist who checks out the woman. We have a geneticist, which is me, who will talk to them about the specific genetic issues they may or may not have, or which may turn up during the treatment. And we also have a separate head of department looking into the surgical aspect for laparohysteroscopy. So we, you know, our idea was to create an entire panel of experts that's going to help patients, not just in having a child, but also in managing their reproductive health. So we get a lot of couples that come for premarital counseling or even marital counseling or even maintenance of their reproductive function during marriage, even if they're not looking to have a child at this point.
So, Dr. Sayali, till now we discussed about male and female. The both genders we have discussed, and now I feel that we are living in the society where we see other genders as well. So in that case, how we have to see the transgender's sexual health, wellness and reproductive health?
So, Dr. Himangi, you raise a very important point for the society. The biggest problem and challenge that we're facing right now is most people in society do not recognize the third gender, do not recognize the other sexualities that are present, do not understand the spectrum, and now we are learning slowly and steadily. However, there isn't a lot of openness in healthcare practitioners at this point of time in treating or even understanding the third gender. So when we were in US, we did learn about transgender health. When I did my ASRM certification, which is American Society of Reproductive Medicine certification, we did have a chapter or, you know, learning about how to handle transgender sexual wellness issues. There are a lot of them that undergo transition therapy, for which they require a lot of help from reproductive medicine specialists. And so we encourage encourage anybody who is on the spectrum, LGBTQ, AI+, or identify as transgender, identify as intersex, or do feel that they are not being understood. We are open to them approaching us for sexual wellness or reproductive health issues. And yes, we are also learning, because as practitioners we see very less of these patients, and when we do see them, we work with them, we have an open communication, we learn from our we learn from our teachers that are sitting in the US, that are sitting in Europe, and fortunately I've had a great a team of experts that have trained me. So that is something that I think should come into practice, and that is, I think, something that we want to bring in practice. And we do online consultations for our entire panel of doctors is available for anyone who wants to do anonymous consults. Do not wish their families to know, or do not wish their they don't want to walk into a center to do it. So we really we encourage everybody to seek out help wherever they can.
Correct. So here, till now, the work you have now done, lot more things, like 15 years of work experience. In that large span of your work experience, what are the major issues you felt? These are the major issues you felt we need to work on, or people should concern about these issues.
So there are so many issues that I think that would need another YouTube video, but let me just off the top of my head tell you about a few. For the men, let me talk about men first, because very few people actually address men.
True.
And even less women address men.
Yes.
So I'm one of the very few women in the industry who actually talk about male health and talk about male fertility. Because we do a lot of surgical sperm retrieval, testicular retrievals for men who have azoospermia and other issues. So for men, especially for men out there, there is a lot of stress that's taking a toll on them. A lot of diet and lifestyle issues that is causing asexuality or low libido, and they are not seeking out help for this. There is shame, there is embarrassment, there is a feeling that, oh, it affects my manhood, what will my friends say, what will my wife say, what will my parents say, I don't know, all this sort of stress that they have on their head,
the societal
image that the man has to be a man, and he cannot have any problems. They're human beings, they have problems. And we just really encourage that seek out help. We really have a fantastic panel of doctors. We have a psychologist on panel, we have a urologist on panel. We need more men to really seek help, because the faster you get help for these issues, the lesser your infertility issues and lesser your libido issues in the future. Because having a good sexual life with your partner, or as a single person, whatever you choose to do with your life, is important as a human being. So that's the one problem that I have seen in men, that they do not come out with those issues. And for women, women are far more prone to seeking help, and that's what I love about women. But women today, maybe COVID is a factor, I do not know, we don't have enough evidence to say COVID is a factor or not, but we have seen a lot of women coming with premature ovarian failure. They are losing their eggs very fast.
Okay.
And a lot of it could be diet and lifestyle, and a lot of it could also be long COVID. We are seeing a lot of anecdotal data, clinical data, where we work with patients directly. We do not have any publication out, so I cannot claim this. But what I'm trying to say is there are multiple factors that are working against the egg reserve, or the amount of eggs a woman has, an Indian woman has. So we suggest any woman that is in their reproductive age to just get themselves tested, to make sure that they are okay. And because apart from fertility, there are other issues that come with premature ovarian failure. If you go into menopause faster, you're going to have a risk of osteoarthritis, you're going to have a risk of other hormonal factors, you're going to have a risk of a certain type of cancers. So you have to know what your risk factors of medical issues are, and you need to go and work with the fertility unit. And fertility is not just to have children, is what I'm trying to say. Reproductive medicine and fertility is to make sure you're living your life well. It's not just a place where IVF children are born. IVF is just one thing we do. There are a lot of other things that are required for a man and woman to maintain their fertility and sexual health throughout their lives.
But nowadays, I heard that even if you have an advanced age, still women are giving birth to the child, and so how it is like happening, or how uh, the wellness of that child would be.
So now we are talking about advanced paternal age women giving birth either naturally or via IVF or via other reproductive aids. So one of the things that a fertility center does is IVF, which is in vitro fertilization. In such a case, the health of the children has been studied. There have been long-term follow-ups, and children have the same health as that of a child that has been naturally conceived. So that's a great thing. And we were always waiting for this research to come on because we wanted to support the children that were born through our IVF. Because now the oldest child that has been born in our center is, she's 22.
Oh,
so so now these children are grown up, and we want to make sure that they are not facing any health issues, and every doctor wants the child that has been born in their hospital to be healthy. So that's one thing, that IVF children have the same risk as naturally conceived children, and that's a good thing. Another thing is that however, when you do IVF, the risk of advanced age does not go down. So a lot of the times when you're doing IVF with donor eggs or donor sperm, they really you can conceive at the age of 48, and it's allowed. By law, you're allowed to conceive even at 48. So at such a time, if you are not utilizing your own eggs, you are utilizing your husband's spermatozoa, you have to understand that men's sperm also gets affected by age. And at such a time, your genetic counseling, your genetic testing, your prenatal genetic testing of the fetus, if there is a pregnancy, has to be done to ensure that the child born is free of congenital anomalies and free of chromosomal abnormalities, which is genetic defects. So that is why geneticists and prenatal genetics is become a very important part of IVF. So there are multiple factors that can affect an IVF pregnancy, and we have to be careful about it, and we basically have to monitor the patient till birth.
Okay. Yeah, really great insight you have given, Dr. Sayali. So here I just want to know, because our people are watching and they also should know, what are the precautions one should take for their sexual wellness and reproductive health.
So I'll be very, very honest with you. The first thing that people need to do is understand that diet and lifestyle is going to be the most important thing that is required, and there is no shortcut. If you ask me to give you a pill to solve something that's been wrong with you for 20 years, that's not gonna happen. Of course, there will be aids, there will be help, there are certain medication that will help you, but you have to make the effort to actually change your diet, actually change your lifestyle, get more exercise to really improve your sexual health. In terms of reproductive health, yes, there are a lot of factors that can stop you from having good reproductive health. Could be physical barriers, could be problems such as vaginitis or cervicitis, which is why your sexual health is being impaired, or your couple sex is not satisfying or is problematic. Like I said, ejaculatory dysfunction by the men could be one of the factors why they are not having a satisfactory marital life. These are the issues that can be solved in a reproductive medicine unit and can be talked about by a panel of doctors, and you can always seek out help. However, diet, lifestyle, if it's not solving your problems, you should definitely visit a practitioner. But I would like to also point out that a lot of gynecologists and a lot of general practitioners do not have the right education or knowledge to really guide you in such a regard. So go to a unit that really talks about openly and transparently about this, about sexual health and reproductive health, and really gets you the help that you need.
Yeah.
So the primary precaution is catch it early and talk to a doctor whenever possible.
Yeah. So Dr. Sayali, as now you have turned as an entrepreneur, scientist Now you have turned into entrepreneurship.
Yeah.
So what exactly you are doing and what are your future goals?
So this journey of entrepreneurship has been very exciting and very fulfilling for me as a person, because when I was in research, I did not think that I would be running a business, multiple businesses at this point of time. So today, one of the businesses that we have had that I had started 10 years ago was Celcio Biotech and Research Center. We were Southeast Asia's first commercial human egg bank, and we catered to more than 75 clients, IVF centers across India. Beyond that, today we are in clinical research. We work with centers in Dubai, India, US based. We also have total quality management services for IVF centers. So a lot of it is healthcare related. And the hospital that I run today is basically Akruti IVF LP. The hospital is in Bombay. It's in city called Dombivli. And there we are building the vision and building the dream of an all-inclusive fertility and reproductive medicine unit. And what do I mean by all-inclusive is we have a panel of experts. We have a panel of doctors, a large range of doctors, right from uroenterology, gynecology, infertility specialists, geneticists, embryologists, and psychologists, genetic counselors on the panel. And apart from this, we have the technology to back it up. So we have in India, we have one of the very few centers that actually do microscopic testicular extraction of spermatozoa, which is not possible in many units because of the large investment that is required. So it's called microtested procedure for andrology for azoospermic patients who have no spermatozoa in their samples. We even have one of the first second generation time lapse. So ours was the first second generation time lapse technology that was put in India. And we still have it, and it's one of the top tier technologies in the world for IVF. We do all the technology like pre-implantation genetic testing, diagnosis, sperm vitrification, oocyte vitrification, egg freezing, you name it, we have it. So any technology that is available in the world is available with us. And it's not technology that treats patient, it's the person. And we are really proud of the team of doctors that we have built, and really proud of the clinical team we have built. We have more than 30 people involved, and we are building a center of excellence in Dombivli, where not only the people of my city can get treatment because I'm born and brought up there, but also people all over India. So we have had people from all over India, Toronto, US, Dubai, Afghanistan, UK coming in for treatment with us.
So it is a physical, like a face-to-face treatment, or you have online consultation?
So we have both. Okay. We have both. So if you are in the city, a lot of it is physical one-on-one contact treatment, because if you are in the city and you want to see the patient, you want to see us, you want to undergo certain tests, diagnostic tests like ultrasonography is there, or sonosulfingography is there, laparohysteroscopy is there. So any sort of diagnostic testing, any sort of blood testing, any sort of consultation that is required can be done one-on-one physically. And so we have OPDs for all our doctors. And we also have online consultation systems for oral specialists, which we run through the online platform. We also have a huge electronic medical record that manages all our patients. So we have more than 10,000 patients on record on database that we have been managing for years on that. And it's a very robust system. And we, like I told you, we provide total quality management to IVF centers all over India.
Wow!
So there is a lot of technology and a lot of best practices that come out of our center that we want to move across to our countrymen, because we believe that reproductive health is paramount to a person's well-being.
Correct.
And it's not just having a baby. it's your overall path to living a fulfilling life.
Yeah, that is really very remarkable statement you have made. That reproductive health is not just a producing baby, but it is like lifelong the how the life you are leading.
Yeah,
That is
the
very
quality
important.
of your life
Quality of
is
your
dependent
life,
on your
yeah.
reproductive health.
And that is really very important because I come from the sociology and social work background, and till now we have thought that reproductive health means only the that's what the reproducing your babies and then lactation and the pregnancy and all these things, and that is also you have really dismantled my misconception about only the woman has the reproductive health and men they don't have any concern with
men are men, they
yeah.
don't have problems.
Yeah. So really you have given a really very enriching kind of insights about the sexual well-being, reproductive health, and really we have talked about all the genders, male, female, and transgender, and the reproductive health means what, and it really go along with the age you carry or even the advancement of your age. So it is really very rich kind of insightful discussion, and I really have very strong conviction that this discussion definitely will help to our people, and not only the young generation but all age of people. As you said, this reproductive health is not only the producing the kids, but it's lifelong this thing. So thank you, Dr. Sayali, for giving your time and your valuable knowledge, sharing your experience with me, and definitely this will help to our people and the larger audience. And I really have a very long hope or strong hope that this discussion will not only help to the Indian people but across the globe. And thank you for it.
Thank you so much for inviting me, and it's been a pleasure to be a guest on your show. Thank you.
Yeah. And thank you for watching, and I will keep on updating the new videos with you. Thank you.